When my daughter died in 2001, Brittany left behind a legacy of compassion and care for the people in Kenya. Today we operate an orphanage, a school, and a clinic called the Brazzi Clinic and Vision Center, where we provide specialty care for thousands and thousands of Kenyans.
I was living with my mother. My mother died. Then we were brought here with my sister.
When I come, I mean, my heart nearly explodes with joy because I know the situations that these children came from. I know that, they would have been dead, or they would have been in misery, or they would have been without hope. And to see a child now that is engaged in life, their eyes are full of life. They play, they love.
We've had over about 200 children that have been in this program. And all those children have passed through this home here, this orphanage here. So it is very important because these children that we support, that Kenya Relief support, some of them, the homes that they were living in were not very good. They are not in good condition. So when they are brought here, their lives have changed and they be safe, they get good life here. I think we started with around 9 children, then the number increased. Year by year, we are increasing the number. Even the services that we are now giving the children have really increased because at first we had just a few staff that were working with the children, but now Kenya Relief has really grown and we have so many people working to make sure that these children are getting good life.
Majorly, students of Kenya Relief Academy are drawn from orphans who are sponsored by BHOG, Brittany's Home of Grace, and then the community children are also integrated in the school. The school offers quality education, and the classes are standard to the region. The staff they have is well qualified, and then the reason why it's important. Most of the public schools or the schools around, they are flooded with pupils, where you find a class has 90 pupils in a class with 1 teacher. But at Kenya Relief Academy, that number is controlled with a maximum number of 25 to 30 to be in a class.
We just finished up a thyroid. I think we're down 4 today so far, and hopefully another 4 to 6 left to go. So we're gonna keep it rolling. Got a few clinic patients to see, and take a little break in a few minutes.
At Kenya Relief, we have an outpatient surgery center that accommodates about 15 to 20 surgery teams a year. I'm a CRNA by profession. I came to Kenya some 12 years ago and worked in a rural hospital in Kenya, kind of an average hospital. I was completely overwhelmed to see people suffering from, a variety of things that could be prevented, or, it just touched my heart so much that, I knew that God had gifted me and prepared me all my life, 30 years in the healthcare field, to do what I do today.
Medically, well, there's always room for expansion. Every time I come, we're generating new ideas for we could use this machine and that machine, but we're most excited about the hospital project. We have the plans laid and we're raising money to create a wonderful facility that's going to be just open new ground for pretty much the whole of Kenya.
Our long-term goal is to create a full-service hospital that can care for the needs of more than 2 million people that live in that district. Kenya Relief is positioning itself now to be the premier provider of health care in Western Kenya.
my hope or my prayer for Kenya Relief is to grow big and big so that we can even have more branches for Kenya Relief all over.
Join us, and together we can leave a legacy of hope.